My name is Sharon Chalmers. I'm a board member and a volunteer nurse practitioner at Good Samaritan Health Center of Gwinnett. Good Samaritan Health Center is a safety net health clinic for the underinsured and the uninsured. We see approximately 18,000 medical visits per year, and our population is predominantly women. Hispanic women at that, and most are between the ages of 35 and 40, and they make approximately $18,000 per year. So our mission at Good Samaritan Health Center is that of caring for the healthcare needs of those that are not able to afford healthcare, and also to teach the next generation of healthcare providers. And so in that process, at Good Samaritan, we have a variety of healthcare students. We will have nurse practitioner students, nursing students at the baccalaureate level. We will have PA students, MD students, DO students, and they're all precepted by someone that is in the healthcare profession that is at their level. And then we have students that come that are preparing to apply to the PA program or an MD program, and during that process they are required to have hours that are volunteer hours. And at Good Samaritan we have students that come and will volunteer as many as 1,000 hours in preparation for application to the PA programs or the MD programs. We see approximately 35 to 50 patients per day, and it depends upon the number of providers that are present. We also will see anywhere from 15 to 20 patients that are non-clinical patients that are asking questions about their health care. They're coming to see the diabetes educator, or they may be coming to see the psychologist. All our patients are screened for alcohol and substance abuse. That is completed in triage, and it has become a standard that all patients are asked the same pre-screening questions, just right along with tobacco use. Time at Good Samaritan is always an issue. There's many more patients to see than there's ever time. And so the process that we have in place, where the questions, the pre-screening questions and the audit questions or DAS questions, whichever is appropriate, are given outside of the provider time. And so the provider has as much time as providers get, but some of that information is already taken care of. And so those questions, the answers to those questions will be present for the provider as they go in for the visit itself. At Good Samaritan, the patients will enter into the triage area where the medical technician will ask them the pre-screening questions. And then they will input that into the computer, and then will escort the patient from that point to the examination room. Meanwhile, the provider has the information from the pre-screening questions, and they will know that if there is a positive response, they will then know that this is a patient that needs further intervention or possibly even referral to treatment. They will discuss that with the student, and then the student will go in to the visit and introduce themselves to the patient, and then we'll ask them more questions concerning their positive responses to the pre-screening questions. Then the student will discuss that with the provider, and the provider then will enter with the student, and depending upon what is needed, if it's an intervention or if it is referral to treatment. So all of those are done in tandem with student and provider. Usually on a daily basis, we will have approximately 4 or 5 positive screening results in triage. depending upon the pre-screening questions and the responses to those questions, then the medical technician will offer the patient either an audit or a DAS. And then those questions are then, answers to those questions are then given to the provider. Our advanced practice nurses, nursing students in implementing SBIRT will have the opportunity to be involved in the intervention process as well as motivational interviewing and any type of referral to treatment. Now, referrals are tricky sometimes, and so those have to go through the provider in order to identify which referral is appropriate for which patients. And so the student they do not make that decision. The provider always makes that decision. Now, sometimes students are not quite ready for implementing brief intervention. They've learned it, they've kind of practiced it, but they're not quite ready. And so that too could be in tandem with the provider. And so they may both go into the room at the same time, and the provider makes the lead in a brief intervention and negotiating what's the next step. Our nurse practitioner students that may feel most comfortable with brief intervention and referral to treatment are still in tandem with a provider. They're never left alone. And so even though they may feel very comfortable and they will implement a brief intervention and identify and negotiate with the patient the next step, the provider still will come in and just review and make sure that everything was covered and that if the patient has any further questions or concerns. Advanced practice nursing students during their clinical education will complete a community assessment. And that community assessment can be at any community that they intend to potentially work. And so all of those lists will be different depending upon where they're located. And so we also share that within the clinical classroom so that they can see what other communities, other than the one in which they intend to work, will have resources available. At first, our students were very concerned about even asking the questions about substance use and alcohol use. They were very cautious. And of course, as we began the process where they learned motivational interviewing and were able to utilize their skills and realize that it worked just as well for diabetes or hypertension or changing behavior of any type, then they became very comfortable asking those questions. Once they began to ask the questions and really talk to people about their use of alcohol or substance or drugs, they realized that this is a great way to introduce a topic that is difficult for them. Then we have a clinical competency day, and during that process, the students are asked, how comfortable do you feel with this? And what we found is that through the process of a constant, every semester, talking about substance abuse and alcohol use, drug use, tobacco use, that students become much more comfortable, and then the patient themselves are much more comfortable to talk about it. So once it becomes very everyday, then the students are much more comfortable talking about it and can build their skill in negotiating the next step. The providers have also become much more open about discussing substance use with their patients, and that this has become an everyday activity, and they too have begun to work on their motivational skills, and they realize that this is not just for substance use. This is for diabetes and hypertension and just everyday healthy lifestyle changes, that this works.